Hello and welcome to Bites MD. I'm Dr. Sam and today we're exploring the ketogenic diet or keto diet. This low-carb, high-fat eating plan has gained significant attention for its potential benefits in weight loss, metabolic health, and more. In this video, we'll dive into the origins of the keto diet, the science behind it, the key components, benefits, potential risk, and sustainability concerns. We'll also discuss why I do not recommend it due to its side effects and concerns related to all-cause mortality. The keto diet has a fascinating history. It was originally developed in the 1920s by researchers at the Mayo Clinic to manage epilepsy. The diet was designed to mimic the effects of fasting, which was known to reduce seizure frequency. It became a popular treatment for epilepsy, especially in cases where conventional medications were in effect. The diet's primary goal was to induce a state of ketosis where the body burns fat for fuel instead of carbohydrates. This approach was particularly effective in controlling seizures in patients with drug-resistant epilepsy. The keto diet was the primary treatment for epilepsy before the advent of modern anti-seizure medications. Over time, the keto diet evolved and gained popularity beyond its use for epilepsy. In recent decades, it has been adopted for weight loss, metabolic health, and various other applications. The rise of the diet's popularity is attributed to the increasing interest in low-carb diets and the promotion of the keto lifestyle in popular media and books. So what is the keto diet? It is a high-fat, moderate protein, and a very low-carb diet designed to induce a state of ketosis. In ketosis, your body shifts from burning carbohydrates to burning ketones, which are produced from fat. This metabolic change can lead to various health benefits, but it also comes with potential risk and sustainability challenges. So what's the science behind this? A meta-analysis published in the American Journal of Clinical Nutrition 2014 reviewed 13 studies and found that individuals on a keto diet lost an average of 2.2 kilograms more than those on a low-fat diet over a period of up to 6 months. Research published in Diabetes Therapies 2018 demonstrated that participants with type 2 diabetes on a keto diet experienced a variable reduction in hemoglobin A1C of 0.6% to 1.3% depending on duration of 3 to 32 weeks. Keto diets improve insulin sensitivity to their irreversible effects on low fat and weight loss. A customized ketogenic diet has been shown to reduce seizure frequency in drug-resistant epilepsy by 56% in children, according to a review in Frontiers in Neurology 2023. Numerous studies have shown cognitive improvement following a keto diet, but many of these studies involve relatively small sample sizes, which limits the generalizability of the findings. Larger, more rigorous trials are necessary to confirm these effects and better understand the long-term impact of the diet and cognitive health. Research from Nutrition Reviews 2024 suggests that the keto diet can significantly reduce inflammatory markers such as tumor necrosis factor alpha, interleukin 6, particularly in individuals over 50 years or older, or people with a BMI greater than 30. In addition, studies have shown that the keto diet can benefit individuals with autoimmune disease like rheumatoid arthritis by decreasing inflammation markers. However, rheumatoid arthritis patients are at a higher risk of developing cardiovascular disease, which adds complexity to the long-term management of inflammation in these individuals. To achieve and maintain ketosis, people focus on fats. You aim about 70 to 80% of your daily calories from fats. Try to include healthy fats like avocados, nuts, seeds, olive oil, and coconut oil. Be cautious, as many people on the keto diet, they consume unhealthy fats, such as saturated fats and trans fats, which can undermine the health benefits. Protein, consume moderate amounts of proteins from sources like meat, fish, eggs, and dairy. Protein should make up about 20 to 25% of your daily intake. Limit your carbs to about 5 to 10% of your daily intake. Focus on low-carb vegetables like spinach, kale, and broccoli while avoiding high-carb foods such as bread, pasta, and most fruits. The keto diet offers numerous benefits. It's important to be aware of potential risks and side effects. When starting the keto diet, some people may experience keto flu, which includes symptoms like headache, fatigue, dizziness, and irritability. These symptoms usually resolve after a few days to a week. For those who have type 1 diabetes or those with impaired insulin function, the keto diet can increase the risk of diabetic ketoacidosis. It is a dangerous and deadly condition characterized by extremely high ketone levels and acidic blood. This requires careful monitoring and management in a hospital setting. Those who consume alcohol while on a keto diet may be at risk for alcoholic ketoacidosis. It is a condition where the body produces excessive ketones due to alcohol consumption. Combined with a low carbohydrate intake, this can lead to nausea, vomiting, and dehydration, and even death in some cases as well. The high-fat nature of the keto diet can increase the risk of gallbladder disease or gallstones. If you have a history of gallbladder issues, it's important to approach the keto diet with caution. A strict keto diet may lead to deficiencies in vitamin B12, iron, calcium, and fiber. It is essential to include a variety of low-carb vegetables and consider supplements if necessary. There is increased risk of kidney stones. Stay hydrated and maintain proper electrolyte balance can help reduce this risk. While short-term benefits are well documented, long-term effects of keto diet are still not fully understood. More research is needed to determine its impact on cardiovascular health, kidney function, and overall metabolic outcomes consistently. The keto diet is highly restrictive, limiting carbohydrate intake to such an extent it can be challenging to adhere over long term. This restriction can make it difficult for many people to maintain the diet consistently. Maintaining a diet that is so high in fats and low in carbohydrates may lead to an imbalance in nutrition intake. People often end up consuming unhealthy fats such as saturated and trans fat instead of focusing on healthier fat sources. This can potentially lead to adverse effects on heart health and overall well-being. The restrictive nature and keto diet can affect social eating and lifestyle. It may be challenging to find suitable food options when dining out or attending social events, which can make the diet less practical for long-term adherence. There is a limited long-term research on the keto diet's effects on overall health. Question remains about its impact on cardiovascular health, bone density, and long-term metabolic function. More research is needed to fully understand these long-term implications. When examining the impact of the keto diet on all-cause mortality, the evidence is still emerging. While some studies suggest that keto diet can lead to significant weight loss and improvement in certain health markers, its long-term effects on all-cause mortality are not well established. A review in the Lancet of Diabetes and Endocrinology noted that while keto diet might reduce the risk of specific conditions like diabetes, there is insufficient long-term data to confirm the impact of overall mortality rates. Long-term adherence to a keto diet could have potential risks. Such negative impacts on cardiovascular health due to high saturated fat intake and nutrition imbalances. These factors may contribute to increased mortality risk if not managed properly. In conclusion, the keto diet offers notable benefits for weight loss, metabolic health, and cognitive decline. However, it also presents risks and challenges, particularly when considering long-term sustainability and its potential impact on all-cause mortality. By weighing both the advantages and potential dangers and approaching this diet with caution, you can make informed decisions about whether it's suitable for your health goals. Given the limited data on the long-term effects and its high risk of adverse outcomes, I do not recommend this diet for most individuals. If you found this video helpful and would like to explore more about various diets and nutrition topics, be sure to check out my other videos. Take care.